And so I'm all for legalizing marijuana.
I've called for the end of the prohibition on marijuana.
Should marijuana be legal?
Yes.
Ooh, Corey and Bateau are for weed. Of course they are. In the midst of the greatest and most fatal drug epidemic in the history of this country, marijuana is entering a golden age. Democratic presidential candidates compete to show how cool they are and how much they love it. 10 states in the District of Columbia have legalized marijuana. Most of the rest tolerate medical marijuana, often on flimsy pretexts. Every year the drug becomes more prevalent. Nationwide legalization seems inevitable, probably just a few years away. What will happen? Well, a couple of companies will get very rich. But as marijuana becomes more common, what will happen to the people who smoke it? Well, you're not supposed to ask that question, but we think it's interesting, so we do. A new study in The Lancet, the British medical journal, finds that daily marijuana use substantially increases an individual's chance of having psychotic episodes or developing schizophrenia. No big deal, just schizophrenia. Dr. Marc Siegel is a Fox News medical contributor, and he joins us tonight. Doctor, thanks very much for coming on. I can't think of a disease more serious than schizophrenia. Do you take this study seriously?
This was an extremely well-done European study, Tucker, and it looked all across Europe, and it found 3 big cities, London, Amsterdam, and Paris, all had up to 50% new cases of psychosis were linked to marijuana use. Now, why would that be? Let me tell you a little biology lesson here, Tucker. Marijuana is not what people out there think it is, because the active ingredient that causes problems in the brain, psychiatric symptoms, is now 20 to 30 times more powerful than it was in the 1970s when we were teens. 20 to 30 more times THC in marijuana now. And THC is what's causing all this. It's causing depression, it's causing anxiety, it's causing psychosis. And in places that have legalized pot, fully legalized it recreationally, like Colorado, like Washington, like those 10 states you mentioned, like Canada, the amount of cannabis-induced psychosis is doubled or tripled. It's a real rampant problem.
So I'm a little bit confused. So if this is really kind of beyond debate from a medical perspective, is what you're saying? Like, we know this is happening?
Well, first of all, it's beyond debate from a medical perspective. This study absolutely proves it. 50%, and that's just psychosis. We're not even talking about anxiety and depression. And you mentioned schizophrenia. You know what's really troubling? There are people out there who are at risk of schizophrenia. We give them a lot of regular use of pot. We're talking about regular heavy use of pot. They get a schizophrenic break. They may never come back. We may never be able to treat them out of it with antipsychotic medication. I don't want to scare people out there. You could stop smoking pot. You could use antipsychotic medication. And in some cases, the paranoia goes away, the suspicion goes away, and you come back to reality. In some percent of cases, Tucker, you don't come back to reality and you stay as a schizophrenic, and this may be the reason. This is really, really a disgrace that this is not being considered, and I'm really glad you brought it up. It's becoming a worse and worse problem the more powerful pot gets. And you know when it gets legal that it gets more powerful. It's in foods, it's in juices, it's in cosmetics even, and it's more powerful than what they smoke, what people smoke.
Anyone who's ever seen the tragedy of schizophrenia up close will know exactly what you're talking about. There's nothing more upsetting. Dr. Siegel, I appreciate your coming on tonight. Thank you.
It's a big warning. Thank you for having me, Tucker.
Amen.